Hello, hello, it's Doc Swiner. Welcome to Wellness Wednesday and Ask the Doc. Hello, PG Ninjas in the house. Thank you for inviting followers. Hello, she be knowing. Hello. I see some of my regulars. Hello, ADHD coach, Tyler's daddy, Milton. Yay, happy belated birthday, Milton. Brother Milton in the house. Dr. Rochester, down here, Eraser. Yes, come on in. Come on in. Tierra Toting Lady. Yes. Coach Lynn. Daddy's favorite. Welcome. Thank you. Well, you know what? She be knowing. Let me tell you a trick. Hey, ADHD Coach Lynn. I put on some foundation today. I did this TV thing this morning. I taped this medical minute for a local TV show that we have, or news program. And so I have some foundation on. So I did that for y'all. Hey, Webby V. Hey, my Perry girls. 99 Michelle. Welcome. Happy Wellness Wednesday. Welcome. Thank you. I dressed up for TV a little bit. Hi, Webby V. Hi, Perry girls. Welcome, Heart Tribes. Yes. Come on in. Hey, Dr. Rochester. Y'all making me feel good today. I should, yeah, it's my name. You got to promote, Coach Lynn. Got to promote. I should come on every day so y'all can tell me how cute my makeup is. Hey, Perry girls. Welcome, guys. My notes keep falling down here. Welcome. If this is your first time, my name is Doc Swiner. Welcome, Miss Brittany T. Welcome, everybody. Welcome to PerigirlsTV. Hopefully this is not your first time joining us on PerigirlsTV, but if it is, welcome. House rules are you have to hearts. Hey, everybody, welcome. Come on in. You have to hearts, so we know that you like what we're talking about. Happy Wednesday, hump day. And you have to swipe up and share with your followers and share with your Periscope folks and your Twitter folks. You got to share it out. We like to get this word out. Hello, Dr. CC, ABZCZ. All right, come on in. I'm Dr. Nicole Swiner. I'm out of North Carolina, and I'm pleased to be with you. What I am is a full-time family medicine practitioner or family doc, which is the kind of doctor that I hope a lot of you have, if not some sort of primary care doctor where you see someone from the cradle to the grave to take care of start to finish, everything in between, from the newborn straight out of the hospital up to geriatrics, 99.9 years old. That's what I do. That's what I love. And a lot of what I do, I've developed a little bit of a niche in women's health, minority health. You like that cradle to the grave? It sounds a little bit morbid, but, it gets the point across. But my loves in family medicine include a lot of different things, but I particularly love women's health. I love pediatrics. I love minority health. I love mental health, so I've, developed kind of a niche for what's called the Superwoman Complex. Yes. Hi, Rice and Spam. I am your Superwoman Complex expert because I wrote now 2 books. Yay. On the Superwoman Complex and what that means and how we as women need to be, we need to be more advocates for ourselves and our health and our mental health. So that's what I talk about. But for Perry Girls, I talk about whatever you guys want to talk about. And thank you. Thank you so much, PG Ninja. So for Perry Girls, I've been talking about a variety of things since starting the show a couple of weeks ago. And last week, and y'all have to remind me, I think we talked about pap smears and changes in cervical cancer screening. We've talked about the Superwoman Complex, which, I write about and speak about. We took a vote, and this week, everyone has decided that we wanted, or the majority of you who voted, wanted to talk about save the time. Oh, blood pressure. Thank you, Destin Doc. I see you. Thank you. Blood pressure. The week before that was pap smears, I think. So we've talked about a lot of different things. So my personal channel, by the way, is Doc Swiner. If you want to catch me on Periscope, that's my, that's my name. But I'm here every Wednesday at 1:30. You can watch the replays here on PerigirlsTV. Wonderful. So today, Save the Tatas. Okay, Save the Tatas is a lighthearted way to talk about our breasts, but not so lighthearted when it comes to talking about breast cancer screening. Yes, thank you. Breast cancer screening, mammograms, and there have been some changes that I had to adjust my mind to think about. My patients have had to adjust their minds to think about. So I want to make sure that everybody knows about it. As many people, know about the new changes, because I want you to be educated. I don't want you to be getting your medical advice from Google and, oh, sorry. I don't want you to be Dr. Google and Dr. Wikipedia. I want you to be able to go in with some good information. Lost my 50. That's right, Coach Lynn. I'm so sorry to hear that. We all deal with it in some way. Education is key. That's right, Karen. Education is key because you want to be able to walk in with the right information, and you want to be able to be empowered. Sorry about that, PG Ninjas. Yeah, if you're not a fan of the doctor that you're with, then it's like a relationship. You know, there are plenty of docs around. If you're not comfortable with the one that you're seeing, you don't feel like they're doing the best for your care, then you find another one. Be your advocate. Be your own best advocate. So we're going to talk a little bit about advocating for your health, particularly for women. Men are affected by breast cancer too, at smaller numbers, but particularly for women, it's a huge deal. Hi, Virtue 1969. All right, y'all ready? First, a pop quiz. I always start with a pop quiz to see what you know. So last year things changed. Okay, so that's a little bit of a hint. Last year things changed. At what age should most women, let's say without a family history, at what age should a woman start having screenings like mammograms for breast cancer? What age? Throw some numbers out there. 50, 30. Okay, 30. Hi, Milton. 40, 21. Okay. Getting their first mammogram, what age? 40, 50. Okay, no one's listed it yet. These are changes as of last year. No one's listed yet. I'm going to take a drink of water. Go Rice Girl. How's my head length here to the camera? She always, my Perry girls keep me. Oh, I saw the right answer. Okay, 45. 45. 45. So these are, Milton, don't just throw out numbers. Come on, we'll get educated. So everybody get a pen. Thank you, Karen. I was telling everybody I did a medical minute for a news channel. This morning, so I put on some extra makeup for y'all. So thank you for saying that. All right, so as of October 2015, from the American Cancer Society, thank you, the age has changed to 45. I know, Coach Lynn, that's what I said. That's exactly what I said. I said, 45, what do you as a family doc, unfortunately, I see and treat all age, or fortunately, I see and treat all ages, meaning I've seen 30-year-olds with breast cancer. I've seen early 40s with breast cancer. Right. So disclaimer, by the way, disclaimer, I'm always going to put out my medical disclaimers. Please always go and talk to your doctor about these things. If you have any question, any concern, go see your doctor, okay? But October 2015, the American Cancer Society said, start your first, yes, disclaimer always, start your first mammograms at 45. Now, there are always caveats. They did say a little asterisk. Yes, so actually that's a good topic for, that's a big topic, Miss Brittany. We can talk about that either offline or for our next topic, but that's a good one for cystic fibrosis. But asterisk, a woman can have it at 40 if they want. Insurance won't pay unless it's recommended. It depends on what insurance you have, Miss Tiara, toting lady. So, you can have it when you want it. So the big deal with, or the thing that I always want to drive home with all of these recommendations, these are things that, hi, welcome, Beret and China. With all these studies and things and data and numbers and research papers and all these, we come up with things and we put it on paper as to say, okay, well, this is the national recommendation. You always have the right to go to your doctor and say, I don't feel right. I think I need this test. And then you all should have the conversation. And you're right. The insurance may not pay for it all the time if they don't agree. You have the option to pay out of pocket. But the way that I talk to my patients at recommendations, that's right. So the way that I talk to my patients about any screening, any decision that we make is, as long as I can't prove that it's harmful, then we have some wiggle room, okay? Personal story, and then we'll get back to the recommendations. Personal story is, so again, I see from the cradle to the grave, meaning I see women, men of all ages. I've treated, unfortunately, I've found 30-year-old women with breast cancer, early 40s with breast cancer. My mother-in-law, God rest her soul, one of the best women that ever lived on this planet, had a history of breast cancer. As a 30, I'm going to tell my age now. You ready? Don't tell anybody I told you. As a 38-year-old woman last year, 37, 2 babies, a lovely husband, living life, loving life. I said, you know what? Maybe I should just go ahead and get one. You know, why not? I couldn't think of any reason not to. I couldn't think of the cons. I could only think of pros. So I sat and had a conversation with my husband. Thankfully, yeah, why not? So, you know, I don't have the risks, thank God, of family history, blood related. I don't smoke. I'm not on hormones. I'm sorry, Miss Brittany T. If you catch me on Doc Swiner, I might be able to find some folks that I know in Arkansas to get you a good primary care. Ask your friends. Ask your friends who are good doctors. But, excuse me, okay, good. But I decided, you know what? I feel better getting a mammogram. Yep, and we'll get to that. Family history is another asterisk on the guidelines. But I said, you know what? I'm 37. I love my life. I have children that I need to be around for. Why not get a mammogram? I said, you know what? I'm going to do it. Went in, and if you, by the way, of course, I got to put my commercial out there. If you've purchased my second book, wink, The Superwoman Complex, a follow-up visit. Actually, a lot of this is already in there, so you know I got to do, don't get mad, Perry Girls. You know I got to do my thing. A follow-up visit. So this is about time for a checkup, okay? And I talk about these things. I even have a picture of me when I went to get my mammogram. Let me show you. So this is me not looking happy, standing in front of the 3D mammogram machine. This is me, right? Available on Amazon and DocSwiner.com. But I went ahead and did it. I said, let's bite the bullet. You have to hold your breath. Right. So they told me, okay, this is your first mammogram. The 3D one shows a little bit more detail, so they don't have to compress as hard. But yes, there is a squeezing. Didn't hurt at all, folks. Thanks, PG Ninjas. Always helping me with my notes. Did not hurt. Didn't hurt. Of course, that's the first thing you think about. Is it going to hurt? Didn't hurt me. And I feel bad for ladies who either avoid getting mammograms because it does hurt, or they're fearful because they heard it hurts. Didn't hurt at all. I mean, folks, if you've breastfed babies or have had to wear, you know, uncomfortable things, the new machines are much better. Never knew that. Oh, yeah. Ovarian cancer is definitely kind of in its own category. There's no great screening for ovarian cancers except for genetic testing, Brittany T. But I went ahead and did a 3D, compressed it. It squeezed less and for maybe a little bit longer of a time, but it did not hurt at all, folks. They told me because it was my first 8 children. Karen, you are a beast. First, PG, just stop it. If you've breastfed and all that, this is nothing. Breastfeeding is worse than this, okay? And I'm a breastfeeding advocate, but Karen, who breastfed 8 of her children, can tell you it's very uncomfortable at first, clearly. Mammograms are nothing compared to that. So I said, we can do this. Anyway, they said it's your first mammogram. You'll probably get a call back because we don't have a comparison. That's right. 8. Yes, you heard my cousin right. You don't have a comparison mammogram to put up next to it to say, okay, well, this is our baseline. So you will probably be called back your first time. That's okay. You know, just be faithful, be okay. Expect that you'll probably get a call back. I had to come back to do an ultrasound on a couple of different areas that they saw. Thank God it was normal. So I'm good. So what I personally decided is, yes, these recommendations in October 2015 said wait until you're 45. You can do it if you're 40 if you want. Most insurances will cover it at 40. I said, at 37, I'm going to go ahead and do it. I'm glad I did it. It was fine. Hello, Donald Hickman. Hello, welcome to those just joining us. We're talking about breast cancer screening. Save the Tatas. So now I feel good. I feel comfortable. I'm going to probably end up having another one at age 39, 40, just to kind of check up on that. I decided not to wait until age 45. Before you were pregnant? I wonder why, Stokes. Were you at risk? So let's talk about being at risk. So those, some of you have already mentioned family history. Brittany T mentioned ovarian cancer. If there are, my insurance did pay for it, Brittany. My insurance paid for it. If it didn't pay for it, I would have paid out of pocket because it was that serious to me. Okay. So family history. So if we're not starting until age 45 with these new recommendations, these are from the American Cancer Society from last year, October, not even a year, October. When should you have it with a family history of breast cancer? What age? What age should we have our first one if we have a family history of breast cancer? Mom had it, sister had it, aunt had it, grandmother had it. At what age? 30, 35, 30. Okay. Okay. Good guesses. So interestingly, there's not a specific age that they listed. Okay. If you ask me as a family doctor, dad had lung cancer, that's sad. October 2015, PG Ninjas. So even more recent, 2015. I say 35. But again, that's me. Disclaimer, go talk to your doctor. I, as a family doc that does, pap smears, breast exams, all that stuff, got it. I say if you have a family history, especially if they're a close member of your family, and this is an immediate family member, like someone that, is close to your family. So your mom, your sister, grandmother gets a little distant. That's second degree. First degree relatives, mom, sister, during pregnancy. Father having breast cancer, also a huge, I mean, you can think about that. I mean, it's rare for men to have breast cancer. So if you are related to a man having breast cancer, then that's a big deal. I screen my folks that have had a significant family history, 35. Oh, that's not good. Yes, men can get breast cancer too. I'm sorry to hear that. So again, let's go over recommendations. Yes. So the gene that you can get tested for, BRCA, BRCA, which is kind of, you can remember it because it kind of looks like breast cancer. BRCA gene, there you go, is a gene that you can get tested for if you have multiple family members with history of breast and or ovarian cancer. If you have the BRCA gene, then you can do big deal. So yeah, I'm glad that you're up on it, Coach Lynn. I'm glad that you're up on your family history. If you do have presence of the BRCA gene, then you have options. You can do who is it? Is it Jelena? What's the actress? Jolie, and have her breast removed. She said, "I'm not waiting." Angelina, thank you. Why can I never get my celebrities' names right when I'm doing these things? Angelina Jolie decided to have a bilateral mastectomy because of a positive family history and gene. Do what you need to do. I think I'd probably end up doing the same thing. It's life-saving. I don't want any trouble. I think I'd probably do the same thing. Okay? So, that's right. They're not worth it. We'll deal with some other stuff. Yeah. So again, October 2015, no mammograms till 45. You can have them at 40 if you'd like. I decided I wanted it sooner, but these are what the recommendations say. Yearly at 45, every year. Okay, 55, she's in remission. Oh, thank God. Yeah, remission. Age 55, every other year. Okay, and then here's another big one. Y'all ready to have your minds blown? They said no more breast exams, meaning self-exams, feeling. Swallow that for a moment. No no self-exams at home, and no doctor exams. Why would they say that? Right? Okay. I got to give you both sides. Okay, so I got to support the medical side, then I got to support the personal side. Medical side says, okay, she be knowing, okay, the ages, so recommendations are to start at age 45. You can start at 40 if you want. That's every year. And then age 55 every other year. Okay, so you're right. I hear you, Coach Lynn. I hear you. Medical side of things says, and so you have to think about it. Medical side of things, how many of us have been at home doing our self-exams, or we went to the doctor, did an exam there, found something we were worried about, okay? So, I have a lump, I need to be checked. Go and have the mammogram, go have the ultrasound, it's normal. Thank goodness, nothing's there. Or, mammogram, ultrasound, falsely positive, you end up having to have a biopsy, but nothing's there. That happens more often than not, that we think we found something, we thought we saw something, we did the screen, nothing was there. Sometimes we ended up getting a biopsy, nothing was there. Thank God, but think of how much stress, anxiety, money, time that costs, okay? So from a medical standpoint, it's unnecessary. However, from a personal standpoint, how many of you all know that Dr. Swiner is a little bit of a rebel when it comes to these? I'm a rebel when it comes to a lot of these recommendations. I still encourage my folks to go ahead and do a self-exam. Yeah. do a self-exam. That's me. That's me in my practice. And that's me personally. I still do a self-exam. I try to remind myself after every menstrual cycle. Sorry, guys, didn't want to hear that. But after every menstrual, or at least once a month, I still do it. Yep, I still do it, and I still encourage my patients to do it.